This is a public hearing of the Committee of the Whole regarding bills number 180, 162, 180, 163, 180, 164, and resolution number 180, 185. Mr. Stitt, please read the titles of the bills and resolution.
Bill number 180162, an ordinance to adopt the capital program for the 6 fiscal years 2019 through 2024 inclusive. Bill number 180163, an ordinance to adopt the fiscal 2019 capital budget. Bill number 180164, an ordinance adopting the operating budget for fiscal year 2019. Resolution number 180185, resolution providing for the approval by the Council of the City of Philadelphia of a revised 5-year financial plan for the City of Philadelphia covering fiscal years 2019 through 2023 and incorporating proposed changes with respect to fiscal year 2018, which is to be submitted by the Mayor to the Pennsylvania Intergovernmental Cooperation Authority, the authority pursuant to the Intergovernmental Cooperation Agreement, authorized by an ordinance of this Council approved by the Mayor on January 3, 1992, Bill number 1563-A, by and between the City and the authority.
Thank you, Mr. Stitt. Today we continue the public hearing of the Committee of the Whole to consider the bills read by the clerk that constitute proposed operating and capital spending measures for fiscal 2019, a capital program, and a forward-looking capital plan for fiscal 2019 through fiscal 2024. Today we will hear testimony from the following city departments: Office of Homeless Services, Health Department, Department of Human Services, and Behavioral Health. Mr. Stitt, the first person to testify from the administration is
Liz Hirsch.
Thank you. Please come forward.
Good morning.
How are you?
My name is Liz Hirsch. I'm the director of the Office of Homeless Services. This is Tara Gaudin, Chief of Staff, and Peter Curran, our Budget Office. Thank you very much for the opportunity to testify, and I'm very pleased to provide this testimony on the Office of Homeless Services Fiscal Year 2019 operating budget. Before I begin, I would like to acknowledge the staff of the Office of Homeless Services. They work tirelessly. They're the highest quality professionals. They're dedicated, and the city would be in much worse shape if not for all of their efforts. So I'd like to take a moment to thank the Office of Homeless Services staff. I would like to also acknowledge some of our providers, part of our extensive high-quality provider network who is here, and some of the consumers, people with lived experience who have experienced homelessness themselves who are here as well. I want to thank them for being present. I'd like to thank you all for your support, City Council members. The Office of Homeless Services takes our stewardship of public dollars very seriously. We provide high-quality, person-centered, data-informed, accountable, and transparent services to meet the needs of those experiencing homelessness and the needs of the larger community. Our mission is to make homelessness rare, brief, and non-recurring. My testimony today highlights just a few of the high points of our work over the past year. Addressing opioid-driven homelessness. The opioid crisis is driving the growth in street homelessness. While it has been affecting every neighborhood, Kensington has been especially hard hit, with 200+ people living under the Conrail bridges north of Lehigh. This is the second highest concentration of homeless people outside of Center City. While street homelessness is never desirable, this high concentration people who are actively addicted, living on the street in a dense residential neighborhood, poses health and safety challenges we have not encountered before. In response, we have and are taking action. We established a 40-bed respite center in Kensington in December 2016. It has served 160 people in its first year, nearly half of whom have entered treatment or housing. Building on this successful model, we are now adding a second 40-bed respite, which will open in May. If the proposed budget is approved, it will be able to fund 80 respite beds in FY19. We have 75 units of Housing First dedicated exclusively to people who are homeless and have opioid use disorder. This is a first-of-its-kind program in the nation. Over half have entered treatment or are now practicing abstinence. The mayor has proposed funding another 60 units next year, and I hope you will support this needed expansion. We are launching an encampment resolution pilot this spring to address 2 of the encampments using the successful San Francisco carrot and stick approach that combines intensive services with a 30-day window to permanently closing the camps. The University of Pennsylvania is evaluating this pilot. We have engaged the civic associations and community development corporations in this planning process. The second highlight I want to provide is in our focusing scarce housing resources on the most vulnerable Philadelphians. Since July 2016, when we launched the 100-Day Street Homelessness Challenge, the city, together with our 60-plus nonprofit partners, have housed 488 chronically homeless men and women. This strategy uses the evidence-based model of supported housing, which has an overall 90% success rate. In January 31st, 2018, the Hub of Hope opened as a partnership between the city, Project Home, and SEPTA. They are now seeing up to 375 people a day, and in the first 8 weeks, they have made 415 shelter placements, provided 750 showers, and washed 439 loads of laundry. They have a special living room for chronically homeless people to get more intensive services. In addition, we have many partnerships to help families and youth who are the invisible homeless. This year, we expanded prevention and diversion to help families stay out of shelter and rapid rehousing to shorten shelter stays. DHS and Homeless Services came together to establish a partnership funded by the Barra Foundation to launch a family reunification pilot this summer. And we want to give credit to the Stoneleaf Fellow for this cross-sectional work. The Building Early Links for Learning, or BELL project, led by People's Emergency Center and now funded by Vanguard, is focusing on increasing the enrollment of homeless children in high-quality early childhood education and making homeless shelters more developmentally appropriate for young children. The Housing for Youth Collaborative, the funding for which was led by City Council 2 years ago, which has now been operating for well over a year. It provides youth-centered, LGBTQ-friendly emergency, rapid rehousing, and employment services. They have also added a community navigator, who some of you may remember, Joseph Cole Hill, who helps other young people know what's available and access those services. As a result of this initiative, Covenant House has seen their turn-away rate cut in half. I would like to close with providing you with a few facts about Philadelphia's homeless service system. In FY17, we housed nearly 15,000 people experiencing homelessness. We sheltered nearly 8,000 people, provided transitional housing to 2,200, and permanent supportive housing to more than 4,400, not counting the blueprint. We helped nearly 400 households to be rapidly rehoused through a 1-year subsidy with an 85% success rate, and provided financial assistance to prevent homelessness to 800 more households, mostly families. 93% of those who exit our system to permanent housing do not return. Nearly half have increased their income. Through our 5-year strategic planning process with the help of our national consultant, the Corporation for Supportive Housing, we have identified that our system capacity would need to grow by about 2,000 more permanent supportive housing units to meet the need. Thanks to the extraordinary efforts of people throughout the city, we have slowed the rate of growth in street homelessness against the tidal wave of the opioid crisis and the ongoing erosion of federal investments. But unfortunately, the numbers have grown. We know a lot about what works. In sum, housed people are not homeless. Thank you again for your support. Thank you.
Thank you. Thank you for your testimony. Just got a couple of quick questions. The first one is, you probably know, how are we doing with the Hub of Hope?
Hub of Hope is an overwhelming success. They're seeing, as of the end of March, they had been seeing about 375 people a day. The highest demand services are showers and laundry and clothing. Mm-hmm. And then they have a special living room area just for the very seriously mentally ill, chronically homeless, to try and do the intensive engagement. They shared a couple of stories. One gentleman in a wheelchair had not taken a shower or been out of his wheelchair for about 5 years.
Wow.
And he let them, through this relationship, bathe him, and now he's coming back regularly to be bathed. It's
awesome.
The beginning. Another woman had a complete lice infestation in her hair, and she allowed them, through this relationship, to cut her hair and treat the lice, and then she was proud. So it's those kinds of things, especially with the people who have serious mental illness, where they really excel. We're now providing 1 meal a week and expanding, and we'll expand to Friday, Saturday, and Sunday meals over the summer. And to the greatest extent possible, we're trying to engage some of the providers who have been providing outdoor meals, giving them the opportunity, if they would like to provide meals in the Hub of Hope and develop more of a relationship with the people that they're serving.
Okay. Yeah, that's great. And I know it's early, so in terms of the likelihood of a longer-term outcome, because ultimately the engagement process is supposed to get people in and do an assessment on those individuals so you can move them towards ultimately some sort of permanent housing, transitional housing. But are you seeing any signs that it's possible that that's going to happen?
Yes.
That's our objective. Sometimes we don't necessarily get to
Absolutely, we are. I think what the Hub of Hope does very, very well is that it provides really basic needs for people. It meets them where they are, and then gives them the opportunity to get medical care and to get the assessment to help them access other services. Unfortunately, as you know, we have a limited supply of places for them to go.
Right.
So at 7 p.m., many of them, we are seeing more people use the shelter system because at 7 p.m. someone's there to help them access that system, but that again is temporary. So what we'd really like to see is the next step be from hub to home.
All right. No, that's awesome. You know, actually, you just referenced it in your testimony, is that the real solution to homelessness is a permanent home.
Yes.
Some respect.
That's right.
Yeah, I mean, you know, you bring people in, you put them in. I'm so glad we closed Ridge Avenue, because that was like 13th and Ridge. It was just it was just warehousing people. There's really no programming associated with that. And I probably know the answer to this, but I have to ask it. So with respects to the move towards some level of permanency in terms of housing, what's your interaction with the city, I guess OECD or whoever is responsible for the planning, I guess, and for Doolin, and understand we're hopefully finalizing the selection of a housing director.
Yeah.
We need to get that done real soon. As you have like consistent interaction with them, because at the end of the day, we'd like to see these people transition to the more permanent housing, which OECD is ultimately responsible for stimulating on the public market.
Right. We do. We have a housing cabinet that is convened by Eva Gladstein and Ann Fedulin. We meet monthly. It includes homeless services, behavioral health, PHA, Human Relations Commission, and licenses and inspections. And we have been coordinating our efforts around applications for state and federal funding, private funding, and also coordinating our planning process. So it's a close working relationship. I think from our perspective, The real issue is having some units or resources that are dedicated to people exiting the homeless system or who are at the 30% of AMI and below or who have zero income, because they do have some unique needs. And I think that's really where we need the growth to take place.
Right. As we know, the challenge for us in the public sector, and I guess to some degree the private sector, is always resources, and the dwindling resources coming from the federal and state government over the years has put us in a position where we're not even remotely close to being able to provide a sufficient number of short-term, transitional, permanent housing. I was talking to my colleague about three weeks ago, a month, Councilwoman Kiona Sanchez, about an endeavor that one of her local nonprofits is moving on, and I mention this because I see you reference tiny housing.
Yeah.
I don't know if you get that off of the TV show. But the reality is that, you know, she told me about this move towards building. Council, what are you talking, like 400 square foot? Okay. Yeah. And then talking to individuals from the Housing Authority as recently as yesterday about this trend towards moving towards smaller units. What's your take on that? And I see you reference tiny housing, tiny units. Talk to me about that, because that's actually something that came up years ago. The only problem was that one of the council members at the time wanted them to be on a barge out in the river. I'm like, we're not really, believe it or not, right? We're not really feeling that, but having smaller units. Can you talk to me about your perspective on?
Yeah, you know, we're looking at anything that can bring down the cost of providing a unit. So tiny houses is one of those things. We were approached by a faith-based community saying that they would raise all the money, do all the construction, if we could figure out how to do this. So we have convened a working group, including L&I, their planning and development, and some of the CDCs, and just to explore the idea. And because we think we should look at it, and we're looking at the other models in other cities to see what works. Some places they've done very large developments, which I would be opposed to. I think small developments is better. What I'm hoping to do is to actually hire someone to kind of lead an exploratory process, and our goal is to have an exhibition of tiny houses sometime in the next several months to really explore what this would mean and how is it architecturally appropriate, how do you manage the community so it fits into the fabric of whatever neighborhoods. And then my dream would be that neighborhoods would ask, that we would set it up so that neighborhoods would invite tiny houses in rather than to try and just drop them down. So that's what we're doing. So we hope to have that exhibition to really explore it and educate ourselves sometime in the next several months. Okay.
Will that include looking at container housing also? Because that's also the strategy that's being deployed.
Yes, yes.
Actually for market rate housing. We're looking at that also?
Yeah, definitely we are.
Okay.
The other things we're doing to try and look at lower cost alternatives, we're piloting a shallow rent. We have 40 units where landlords are accepting, rather than the fair market rent, they're accepting $800 a month. We pay $600, the individual pays $200. And that has been very helpful to people who have SSI or SSDI income who can pay a little bit of rent, and they've been using our shelters as their affordable housing. And they cycle through our system, so we're piloting that. And we're also piloting some of our nonprofits like ODAT own property and see if that's offline, and can we help them so they can have 2 or 3 people live there and supervise it in a kind of shared housing situation. Just looking at anything we can think of that would be more cost effective, that would add to the supply of affordable units.
Okay, all right. Well, thank you, and you keep up the good work. Chair recognizes Councilman Jones.
Thank you, Mr. President. A couple of things. I had the honor of attending an event with Mission First last evening, who have partnered with the Achievability Group out in West Philly. A part of that was to hear from people who had actually transitioned from housing into their programs, and they are renovating 74 single-family homes in my district. To hear from those individuals, it was life-changing for them. Is achievability at Mission First, I actually had an opportunity to look at some of the units they provide, well-kept, great maintenance. I doubled back to talk to the residents just to see if they weren't being prompted to say those nice things, but they weren't. Is that the exception or the norm? Is that what you hope to model as a blueprint, or is that just an exception?
Well, Mission First Housing is one of our most important and one of our largest providers in the city. And we believe that the quality of the housing and services that they provide is excellent, and they're very sound in terms of their financial accountability. And they're one of several providers who we believe provide very high quality housing. Project Home, Pathways to Housing, Bethesda, and we have Horizon House, and we have People's Emergency Center, Druding. We have a number of providers who are of that caliber, and that is certainly what we strive for.
So is the struggle to get out of the temporary shelter into them, is that the big Rubicon in the way?
That's it. That's it. Or off the street, or out of safe haven, or drug treatment, or out of an abusive situation. It's really going from homelessness to permanently housed.
Has the cause of homelessness changed over the years, and why people wind up in shelters changed over the years?
It's fundamentally the affordability gap, that people don't have as much money as it costs to pay the rent. And as rents go up and incomes remain stagnant, that continues to be the problem. And especially for people who are reliant on TANF or some kind of disability income, it's just insufficient. A lot of the mothers with children in our shelters have an income of maybe $300 or $400 a month that they get from TANF. So clearly it's not a sustainable income. And disability is about $700 or $800 a month, also not sustainable. I think so that continues to be the cause. And the other monkey wrench, of course, is the opioid crisis we're just seeing a higher number of people who have that disorder.
Are you a part of the eviction task force that was established by the mayor, and what is your role in that think tank?
I'm the co-chair.
That answers that.
What my job has been to listen to tenants and to public interest attorneys and property owners to try and facilitate some solutions that we think would reduce the number of evictions that we're seeing.
Is there a strategy by which people go from shelters to long-term housing, to rental, to ownership? Is that a part of your...
Yeah, and that's great when that happens. Of course, it's a matter of people getting an adequate income to be able to do that, and then to develop the assets. Because I think one of the hard things about generational poverty is that people don't have assets. So that it's hard for them to come up with a down payment or to have the maintenance or whatever for a home to become homeowners. But whenever we can, we love to see that take place, and it does happen.
So one of the things that attracts me to achievability is that people who get that independent housing are also given instructions on how to be a good neighbor. I kid you not, it's a part of their training. Yes, get your life right. We're going to help you get this job, but also when they do the block cleanup, be a part of it. And also how to maintain a property. what to do on routine maintenance, what to do when the water heater goes wrong. And that may not seem like a big deal, but if you're the neighbor next door, it is a big deal. It makes you a part of the fabric of the community. And so as we develop these programs that provide clear pathways, that needs to be incorporated in it. I get a lot of new neighbors in the achievability catchment area, which I'm gonna call from 63rd and Market to about 58th and Market, from Market Street to Lansdowne Avenue. So that's their target area. And so, amazing to me, the new neighbors that I get to meet are from other places. They're from what used to be Temple, North Philly, and to some degree my colleagues in South Philly. So we wind up getting them. Well, they all know Kenyatta. I said, well, you know, I need you to fill out these voter registration forms because you won't be voting for him for a minute. But those new neighbors being assimilated into neighborhoods that have high degrees of home ownership and are now becoming rental communities is an integral training process. And I just want you to, in your future planning, keep that a part of what you do.
Absolutely. No, it's critical. I will say that one of the things that Philadelphia has that's unique and very powerful is the community behavioral health, our managed care organization. And so for, I think, about 15 years now, the Office of Homeless Services has been managing the rent subsidy while behavioral health provides tenant support services. So when people move out of our shelters into permanent housing, the services come with them and are wraparound services. Mobile psych and tenant supports all come with them to help them in their adjustment, both from a behavioral health perspective, but in their maintaining their housing. And it's an evidence-based practice, and it's very, very effective.
So I had the opportunity to go in Council President's district with Mission First, you're familiar. So the reason why we said, yes, come on over, is because the way they kept those units in your district. And the maintenance was high level, high quality. And so we said, yeah, well, come on to West Philly. And we appreciate that partnership with them and achievability, so thank you.
Thank you.
Thank you, Mr. President.
Thank you, Councilman. Chair recognizes Councilman Dom.
Thank you, Council President. Good morning. I have a couple of questions. How many individuals currently would you estimate in Philadelphia are homeless?
We don't have the final numbers from the point in time count, but I would estimate that it's somewhere around 6,000 based on our point in time count, about 1,000 of whom are unsheltered.
So 1,000 basically, would you say, are on the street?
Yeah, on the street, or they're going into, let's say, what we call a cafe on a nightly basis.
Is that including the encampments in Kensington?
Yes.
And is that including the full count in Center City?
Yes.
Okay. And is that an increase from last year?
Yes, it's an increase from last year. The good news is that from 2016 to 2017, the numbers had grown by 35%, and from 17 to 18, the numbers only grew by 10%. So we slowed the rate of growth, but there is still growth, unfortunately. It's a national trend. It's the first time that the numbers have really been ticking up. And most communities, I think, are ascribing this to the increase in the opioid crisis and the continued erosion of any kind of federal support that used to provide more housing options for us.
Is this an all-time high for Philadelphia right now for homelessness?
I don't know. I can get back to you on that.
Okay. And is a lot of this because the hospitals that dealt with mental illness have closed? Is that a big part of this?
I think that was at the beginning of what we think of as this modern era of mass homelessness, that was one of the causal factors. One of the other causal factors was that in the early 80s when President Reagan was in office, that the social safety net that provided so much housing support was really cut in more than half. And so a lot of those programs that had worked, and a lot of the programs that we have that work, the funding simply was not there for them. And we've continued to see that erosion. I think that homelessness and particularly street homelessness are not high on the political agenda at this moment, so we're not getting the resources we need.
I think, Liz, you mentioned in the past the cost of per bed is how much roughly?
We budget around an average of $40 per person per night for a shelter.
So is that about, doing the math, $15,000 a year roughly?
I don't know. You're better at math than I am.
In the ballpark, let's say.
Yeah.
So we actually spend $15,000 for homeless, but $60,000 for prison. It's interesting. 4 times. We need to cut that prison budget.
Well, you could, if you gave us some of that money, we could house people when they come out, and their recidivism rate is significantly less if they're housed.
So.
Then they can get jobs.
Right, I'm in favor of that.
And start paying taxes.
So I'm in favor of all that.
And become homeowners.
So here's my other question. On the budget, if I'm reading your testimony correctly in the budget numbers on page 6, it says that we appropriated about $95,928,000, but your estimated is $92,513,000, which means you still have $2.5 million you could use.
For next year.
Okay.
Yep.
But if this issue is so important, which it is, I'm in favor of you using it to take care of the issue. I would like to see that be absorbed for more beds. You know what I'm saying? Like, we have the money available, we should apply it for this issue.
Thank you. Yes, thank you for your support. Our plan is to use some of the money for the Hub of Hope, which helps with the Center City issue, and then to support the respite beds in the Kensington area, and 60 new Housing First units for people with opioid use disorder.
But in your budget, I just want to call this, so your department is clear on this, you're really asking for about a $700,000 increase from last year, not the 3.3 million. Because we had appropriated $95,128,000. You're only asking for $95,812,000. I know you didn't spend $2.5 million, but your numbers look better than what you're showing, is what I'm trying to point out to you.
Thank you.
So I'm just saying, and if you needed more money, I would support it, because this is an issue that deals with the quality of life throughout the city and deals with people's lives.
Thank you.
So, let me go to the tiny houses, and I'm going to echo what Council President Clark and also Councilman Jones talked about, that transition. When you do the math, I think Detroit's doing tiny homes. I know we've talked to you, my office has talked to you about this. Detroit's doing tiny homes. I think it's costing them $25,000. I'm sure it would cost us double that or more, okay? But even if you do the math at $50,000 a tiny home, and we said as a city, we will back the financing over a 15-year fixed rate loan, the cost annually would be $4,500, not what we're paying, $15,000, 1/3. And then in 15 years, that home, if that person wanted, it'd be free and clear. We would own the home, or we could give it to them. They'd actually have their own home. It's 1/3 the cost to do the tiny homes financed on a fixed 15-year mortgage over time than what we're paying for $15,000 per bed. So I think it's something we could actually have 3 times the number of people housed at 1/3 of that cost. So we should really delve into that, because that could be a great opportunity for us.
Thank you. We'll do that.
So let me ask the next question, because I know I see Councilman Squilla and Councilwoman Sanchez here. The Kensington homeless problem. We spoke to the managing director's office back on a very cold day, I think in January. It was a 10-degree day. They said to us, only 1 out of 150 people in that encampment accepted shelter when they approached them. At Emerald and Lehigh, there were 52 individuals. 1 lady was taken by rescue, and 1 male accepted shelter services. At Kensington and Lehigh, 63 individuals were approached, not 1 accepted services. At Frankfurt and Lehigh, 31 individuals, no one accepted services. How do you get people to accept service?
Well, the first thing we have to do is the right person has to ask. When the police offer services, there's a lot of mistrust and fear.
This wasn't police, by the way. This was through our managing director's office.
Outreach, so our outreach teams have a higher success rate than that. And actually, one of the reasons that we need to add another respite is because the prevention point respite is always full and they're always turning people away. During the 2-week period from Christmas through after New Year's, when we had the Code Blue shelter open, we had 500 bed nights. So people were coming in, and the longer it was open, the more people came in. We believe that the way people accept services is if we start with what they want, if it's person-centered. When we try to force on other people, even people experiencing homelessness and addiction, our view of what they should have, they very often reject it. When we start with what they want and what they need and take a person-centered approach, then they accept it. So I think it's very interesting, for example, in the Hub of Hope, what are people coming in for? Showers, laundry, food. So starting with the basics and our experience with the prevention point respite and the pathways to housing is that when we make it as easy as possible for people to come in and give them what they really need or what they think they need to start, that's when they come in. And so we're building on what's working, and we're building on this model in San Francisco where we start. The very first step is an assessment that's done by the outreach worker, a survey of, what is it, what's your history, what is it that you want and need.
But this is what I'm hearing from some of our outreach workers, and even I've approached a few people. They tell us, I don't know if it's true or false, that many shelters are less safe than a prison, and they're afraid to go to the shelter because they're afraid their belongings will be stolen. How do we make those shelters safer?
Well, there's really not a lot of evidence behind that. I review every incident report, and the team is here today that it oversees the quality of the shelters, and there's really not a lot to back that up. We have set up a participant call line. It's anonymous. It's open 24 hours. It's staffed 9 to 5. The number is 686-4700. What we ask is that people, if they do feel unsafe or they experience something, that they immediately report it. People just saying shelters are unsafe, that's not actionable. We need specifics. We also find that especially people where the addiction is talking, that there are a lot of reasons why they don't accept services. And that's just sort of one that everybody goes, oh yeah, and sort of accepts. So we really welcome any concrete specific feedback about specific shelters, and we will investigate and we will follow through on any complaints we get.
Thank you for your testimony.
Thank you.
Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilwoman Fiona Sanchez.
Thank you. Good morning. Thank you, Liz, so much. Even when I'm losing my cool, your monotone calms me down.
Thank you. And I think you have good reasons for losing your cool.
I've been losing my cool lately. I do want to add that I think it's hugely important that we be creative in our housing menu options, and I do look forward to looking at creative ways. We are designating several LSTOPs, TODs, and we're actually working with an overlay with planning to create these smaller units along Kensington, because one of the things I'd like to be able to do with my 10 LSTOPs is to open up those second and third floors, and I think there's some opportunities there, and we got to be creative in our financing about how do we get to those affordable units. I wanted to ask you how many of the beds and some of the work that you're doing are being financially supported through CBH and others? Are those working, and how can we expand that so that our limited resource, since such a large percentage of the client base that you're dealing with does have addiction and other mental health problems?
Yeah, it's an excellent question. Medicaid does not allow us to use those dollars for housing subsidy at all. What CBH is able to do is provide the wraparound services for those units, and I believe that that 4,400 unit number, that most of those, if not all of those individuals, would be members of CBH and would be eligible for services wrapped around them. Certainly any of our permanent supportive units would have those services. They follow the individual, not the unit.
So, I mean, in addition to the CBH money, we allocate over $100 million to our Department of Behavioral Health. Is any of that money being allocated to support? I mean, they work in partnership, right? That budget is what we put in general operating and CBH, and there's an expectation there'll be a level of coordination. So how much from our prevention and addictive services warehouse is going to support housing, as we know, housing first is an integral part of people's treatment plan?
The funds that I'm familiar with provide the services that are wrapped around the individuals who get the rent subsidy either through HUD or through the city. I'm not as familiar with the DBH budget specifically. DBH does fund the outreach teams. So they fund all of the homeless outreach. So even they're considered part of the homeless services, the actual money flows through them.
So we talked a little bit about the, $15,000 a year subsidy. How much of the new resources in your current budget are you willing or will be available for some of this housing first? You said how many beds?
It would be 60 units. 60
units?
Yeah.
And how much are those 60 units? What's the investment?
So that's whatever the math is, the 60 times 15,000.
I'm with Councilman Dom. I really do think that, if we're going to have an effective encampment strategy, and no one wants that encampment strategy to work more than I and the residents that I represent, do we believe that the 60, in addition to the respite beds that we're creating, is going to be enough for us to tackle all 4 encampments over the next year?
I think that we believe that there are about 200 people living in the encampments.
And there might be more as the weather warms up.
There might be more as the weather warms up.
So what is the recommendation? One of the problems that we have, in addition to the fact that these have become communities, some of the encampments are more violent than others, and we're all aware of the level of human trafficking involved in that. Ultimately, the lawlessness, Emerald encampment being more violent than the other ones, right? What is your feeling around how are we going to deal with that human trafficking component? Because I don't foresee people wanting to come in for services if they're running women, right? Which is the case there. What are we going to do about that component of those encampments?
Well, we're not starting with Emerald, because we think that's a more complicated situation because it's people earning a living, and that will have to be very closely coordinated with narcotics and perhaps the DEA. But what we'll try to do is provide confidential services, so it's a safe space for women to access, or anyone who believes they're being trafficked or exploited in some way, to get connected to services. So our hope is that this will be not a stigmatizing process, that it's just come on in, come as you are, and we will help you sort through all of your issues, whether there's referrals to other organizations or other services, or whether it's provided on site. The San Francisco model actually calls their respite a navigation center. And the idea is that it helps people navigate their way into the other services, that it's not a stop, that it's a way station into a better life.
Yeah, I mean, I just, and again, this is not your call to make. I think that it's unacceptable that in 2018, we are allowing the kind of lawlessness that's happening there, right? Outside of people's addiction and homelessness, the fact that people are openly having sex and women are being trafficked, and we have police officers babysitting this behavior is unacceptable, really. I mean, and so now tackling Emerald doesn't take away the fact that women are being trafficked every day on Emerald Street. And so, again, I think that's just totally unacceptable.
It's a horrifying situation, I have to say, that I don't sleep well at night.
Yeah, again, and I try to get upset with you, but I can't because you just calm me down. Councilman Squilla and I often talk about that. It's like you're their secret weapon to keep us from blowing our tops. So I want to change gears, and again, I think, we're going to continue to have this conversation over the next few months. I think the warm weather is creating a scenario where we're going to have a lot more people, and that 200 is going to become 400 if we don't have multitude of strategies, not barring the situation and the current pilots. I just don't think that's going to be enough, and I think people are really underestimating the civil disobedience we're going to get from residents there. I mean, people are going to get hostile and violent from their part too, because of what's going on. So we'll continue to have that discussion and figure.
I will say, Councilwoman, that one of the things that's giving us some hope is the engagement with the civic associations and the CDCs, and really having, and then also having the police and L&I and streets and having everybody involved. So I think if we can start on the encampment resolution, I think there's maybe other things that we had started to do, and so I think I share your concern. I think we all are very concerned about this, but I think the fact that we're all working together, trying to come up with creative strategies, I think that's the best that I can do.
I just think that this is a very unique population, and some of the people are taking advantage, like everything else, exploiting our enabling situation right now, and the level of arrogance around some of the folks involved. And look, I am not the NIMBY person. I have everything in my district, right? But when I talk to some of the folks involved, there is a level of arrogance about what they feel is entitled. I've been keeping you folks abreast about how they're moving to some of our other public spaces, and they come in with an attitude about their rights and that they can occupy, because this is an occupation, any of the public spaces they want. And I just think that the enabling component of this, is going to backfire on us, because there are people within these encampments exploiting people, and how we target that element of it has to be paid attention to, right? And this is a police enforcement. The police, our district commanders there have been incredible, but we have officers babysitting lawlessness, and that's a little bit of a challenge. And real quickly, because my bell has rung, on Friday we will have 21 evacuee families homeless, and they have not been processed. Is there a sense of urgency about what's going to happen Friday with the folks that will no longer receive TSA? When are they going to get processed? This is Friday. I'm getting calls by the press every single day about the fact that outside of the 5 spots, we have 21 other families who have not been processed. And I know this ended up on your lap too, so is there a sense of urgency, and where do I send people who are coming to my office today?
So we did, Nicole White from Turn actually went to APM 3 weeks ago. She met 25 families and filled out applications for them, so we do have that data for them. And we are working with Bruce Johnson, who's our intake and homelessness prevention specialist, to find out what's the appropriate services that we can provide. We have had people who have access shelter, and we do have homelessness prevention funds available for them. So they can follow up with our office.
They're not being processed. As of this morning, as of a half an hour ago, there is not clear direction. In one of the correspondence with Bruce, it was sort of, can you only send 5 families at a time? This is Friday. So I need in the next 24 hours a game plan about where we tell people to go and they get processed. I cannot send them to Cherry Street if we know we don't have translation services readily available there. So we need to come up with a plan, because this morning there will be articles. Tomorrow, just last night, the TV folks were on this. We need a plan about where we send those families in the next 24 hours.
Yeah, there are bilingual staff on site at Cherry Street who are available.
So as of 30 minutes ago, they were being told 5 families at a time, and so we need that. I need to loop that up. Because
Okay.
we have 21 families that will be homeless on Friday.
Yep, we're happy to work with you. Our staff has been working on it for several weeks. It's a very confusing and complicated situation with
I
a
know.
lot of people involved, but
and
yeah, we're
Elaine,
doing what we can.
And again, I know your folks have stepped in to kind of help process this.
Yes, they
so
have.
I need
Yes.
I need to figure this out. So if Bruce can connect back with APM, because I have folks in my office this morning in Allegheny around. We can't do 5 families at a time. Tomorrow we need to be processing all those families and figuring out what the options are.
Okay, we'll follow up.
Thank you. Thank you, Liz.
Thank you, Councilwoman. Chair recognizes Councilman Squilla.
Thank you, Mr. President, and thank you, Liz, for always being there to answer our emails and questions. And I know they're not always the answers or the questions that you want to hear or the answers we want to hear, but it is great to have a dialogue and constant conversation. To go back to Councilman Dom's about the budget, it seems like we're not asking for enough money in the budget. When we make that request, isn't that something that, taken into consideration with the number of new respite locations or beds or housing that's necessary, that we should be asking for more?
You can ask for whatever you want, can't you?
All right, well, what number would make it work? Obviously, we don't have enough at this point. So what number would make this work to be able to get, even if it's just low barrier housing, because we know housing is a big issue and concern, and we do know that people will not leave these encampments because they don't have to. But if we then have enough low barrier housing locations and all, then maybe this San Francisco model may work to be able to give people an ability to go somewhere where they know they will have a safe place or a safe haven, at least for a short period of time. And if we're only asking for $800,000, I know that supposedly there was $2 million extra dollars put into the budget. But I mean, we see places like New York and others that are almost doubling their budgets for homeless services, and it doesn't seem like we are.
Well, if you make funds available, we will make sure that it gets to the people who need it most using evidence-based practices and data-informed practices to house people.
Okay, well, I'd like to see if you can give me a documented script of the money you need to make this happen from you guys.
And when you say this, what do you mean specifically?
Low barrier housing, more respite centers, funding that will help eliminate encampments. That's something we want to do, correct?
I do.
Yes. So we want to know how much you need to do that. And I mean, I can speak for myself, but a lot of other people here would be on board to support that ask. So I think, listen, it's usually not hard to get people to ask for money. You're saying, give us what you want. I'm saying, tell us what you need. And then let us work on getting that money to you. You know, because we're getting hammered by people in the communities about this also. And they're saying, what are you doing about it? And we say, all right, we're adding a couple $100,000 to this. And they know that, well, that doesn't sound like it's going to help. And to do these, and I know we can't get 100 respites at a time, places, it takes time, you have to find a location, you got to find a provider. But there are some options out there that we've talked about in other places, and that's also going to cost money to do those other locations, possible locations. So let's put that in the budget now. So because if not, we're going to say, oh, we'll have to wait for next year to do it again. And we know that these encampments, since the people have created their own community, and we've had allowed the living into the tents to continue, that now when the summertime comes, we all know it's going to grow. And we get our grungers back or campers or whatever. Everybody has a different name for the guys that come back in the summertime.
Yeah, the travelers.
Travelers. So they're going to see how easy it is just to tent up anywhere and do that. So this is going to grow. And if we get to a point where we say, nah, you can't do that. You could go here. We have places for you. It makes it easier for us to enforce it, and then we could work for police to do that. So my request is going to be if we could get it to the chair and get it to us to see what that cost would be to be able to do the low barrier housing, respite centers, and even if it's other I know people don't like the word shelters, so we give it a different name, and be able to make sure we have the wraparound services necessary in these shelters to get these folks help. Because it's no longer going to be an option saying, you know what, they don't want to come in. You know, they just don't want to because they're very comfortable there. And we know what they have there. They have kerosene heaters in the winter. They have their own safe injection sites there. They have the Narcan with them. They get fed every day. The city comes and cleans up once a week. They're comfortable. Why do they want to go somewhere? And we have to change that mentality and say, no, you know what, we're not doing our job if we're allowing you to live like this. And I think we have to change that mindset and says, you can't be here. We have a better place for you. You have to come. And then I think, but if we say we don't have the resources to do that, then we're only shooting ourselves in the foot and we're going in the circle. So if we could have something given to the chair on the actual cost, and even if it's a yearly cost and an increase in the budget, I think we need to look at that to see how we can support that and work with the administration to make that happen.
Okay.
Thank you.
Thank you, Councilman. I'm surprised it took you so long to say okay. Right? It's like that,
I wanted
right?
to give the man a chance to speak.
I know you were a little stunned with that one. Chair recognizes Councilwoman Gimp.
Thank you very much, Council President. I'll continue on with the hopeful trajectory that I also am somebody who's very invested in seeing your budget, be targeted and grow to to address the significant needs within our city, emergency needs, as Councilwoman Quinones-Sanchez mentioned about our families from PR. There was just a news alert that the entire island went out of power. It's nuts. So, and we have such a tight community and connection with PR, and it's so essential that we show that when they're in need that we're going to be responsive. So I'll be following along with that as well. So I have a lot of questions. Let's see. It's I guess one of the areas that I'm interested in has been this partnership that we've had with focusing in on youth and the work that you're doing to, in particular, support homeless youth. It's been a great project, and building on that existing investment, have you thought about one of the targeted areas that has been long discussed has been youth who age out of foster care and in the DHS system. What is a more coherent strategy that we're using either through the existing investment or whether we need to build out and think through a bigger strategy on that? But what's a more, what are your thoughts on how to develop out a much more coherent strategy to assist youth who are aging out of foster care and housing becomes a central issue for them?
This probably hasn't gotten as much attention yet in our work with DHS as family reunification has, but it's something that the young people themselves, our youth leadership group, the Young Adult Leadership Committee, and our the Philly Homes for Youth Coalition has been working on. The advantage is it's a known quantity of people, right? We know who they are and when they are leaving. And so really working with those individuals to figure out what a pathway forward is with DHS. What the young people themselves would really like is a place. They want like a hub of hope for themselves. The one thing about homeless youth especially is they don't have a place to go. And so that's one thing. And the navigators who can help them figure out the services that are available. Rapid rehousing for youth seems to be promising. There's some concerns about whether that's the best strategy. They're very interested in shared housing. So that they can attend school, particularly get into community college and Temple, or they may already be there. Host housing is another thing that they are interested in. So we have kind of a conceptual framework that they've developed, and we're committed to working with DHS with it, and we've submitted a proposal to HUD for some additional resources. It's a competitive grant. We don't know if we'll get it.
How much would it be for?
It would be, I think, I don't remember the exact number. The first is a planning grant that goes for 8 months, and then based on your plan, then you can leverage other resources for housing for young adults in college, host housing, shared housing, rapid rehousing, and perhaps that kind of hub of hope. So those would be all the things that we would try to develop if we were successful in getting those resources.
Okay. I'd like to see, similarly, I guess, a question would be whether you're working with the school district to identify and support students who are currently facing homelessness and experiencing them. Some of them are not necessarily identified easily through, the formal law of McKinney-Vento, but whether you're working with counselors and other support staff in the school district to identify young people who may have been evicted or are facing emergency circumstances.
Yeah, so that's a great question, and there's been some progress on that. The Young Adult Leadership Committee has come up with an amazing agenda, and they actually met with the school district, I think it was 2 weeks ago, with the McKinney representatives, and the school district sent this gushy email back saying, this is great, this is what we've needed, we can't wait to move ahead. It's all about really training and sensitizing adults into how to help young people. What we learned through the Voices of Youth Count is that young people who are experiencing homelessness hide, and that it is incumbent upon the adults to reach out to them and help them figure out how to access services, unlike adults who can more able to ask for themselves. And so we're really excited about this work with the school district, and the young adults and our prevention staff have also met with all the community school coordinators to try and make the connection of services available.
Do you have a particular relationship with the community schools, especially the high schools?
We've been working through Susan Gabretsky's office.
Okay. I had one question from your testimony. Could you tell me a little bit more about shallow rent? Like, how long can someone qualify for that?
Well, we're hoping that it'll be ongoing. That's the plan. These are the target group that we've been focusing on are people who have a permanent disability. Yeah. So they're getting either Social Security or SSDI because they have a disability. So their income is never going to increase. Therefore, they are always going to need some kind of subsidy. So unless the landlords, when we can only do annual leases, obviously, so if the market were to shift radically, it might threaten the program, but we're really seeing this as an ongoing program. And to get to Councilman Dom's point, we believe it's more cost effective than having people in shelter. The only problem is the math doesn't work because a shelter bed turns over several times a year. But whereas these units are for the whole year for one person.
And how long has this program been going on?
I think about 5 months.
5 months, okay, so it hasn't been that long.
Yeah, it's very, very small. And it's because they're multifamily buildings where the owner has vacancies, and so accepting the lower rent they're still making money. So it's partially unique to Philadelphia because we still have some units that are relatively affordable. We still have housing available, unlike San Francisco or Seattle.
So for the shallow rent subsidies, can it also apply to families?
Yes.
But only if the primary caretaker is disabled, or not necessarily?
In Allegheny County, they're actually doing it with Act 148 money, the child welfare money, and with a very light subsidy. We have not done anything yet with families, but we would very much like to. And the imposition of with the singles of disability to qualify was our restriction, because our analysis of our shelter census is that there's a group of people who cycles through. So people get their checks at the beginning of the month, so they're on the street and they use their money. And then when they run out of money, they come into shelter. So we were trying to stop that churn and also give people a more dignified way of living. It's slightly different with families, and I think we would want to look at, kind of given a precious resource where do you target it?
Well, and how much is allocated in the budget currently for the shallow rent subsidy?
Oh, I think it's about $100,000.
It's a tiny amount.
It wasn't in the budget, so we just eked it out.
And then how many people participating?
We have we have 30 currently, and we're going to expand to 10 more this fiscal year.
I mean,
the other point I just want to make, Councilwoman, is that we don't know what market saturation looks like. Like, I would love to do zillions of them, but we don't know kind of how much the market will absorb and at what point the landlords will run out of units, or they'll say we want the rent raised or whatever. So we've been somewhat cautious and not expanding too fast, given those unknowns.
I mean, you and I are together on the anti-eviction task force, and I think one of the questions that have come up is, you know, of course we have many different programs for short-term transitional types of subsidies to help people, but what we do know is that there is a whole group of folks who are extremely vulnerable, for whom short-term is not going to be reasonable for them. And so we are interested in what your position might be on a more long-term subsidy program that would help keep people in housing. As you mentioned, I think in your testimony, when people find permanent housing, 93% of them don't return to homelessness and half of them increase their income. So we know what it means to not have that, and of course, you know, to be able to move towards that. And of course, I wanted to thank you for working together on this particular case. But, you know, as we know, the issue around our vulnerable residents who are disabled and their access to housing is even more challenging. And then on top of that, as we heard in here, of course, if they have children, then it's additionally more challenging. So we really need some creative ideas, even if they do cost money. I think it helps us think about how much we're talking about. So 2 questions. Can you tell me a little bit about where you might be on the more long-term subsidy programs that other cities around the country are piloting, if you've had any conversations or strategic planning with DPD on something like this, and some thoughts about how you're working with the, you know, communities who are disabled and children with families to really figure out a strategy for them.
Yeah, those are all really good questions. In terms of the supply of affordable units, obviously that's critical. I think the impact fee that was announced last week would be very helpful. The increase in the PHA budget will be helpful, I think. I mean, all of those things help, and the low-income housing tax credit, all of those things. Anything that we can do kind of upstream to help people is important. Our strategic planning process shows that we need about 2,000 additional permanent supported housing units. And so how we make the numbers work on that, I think, is kind of the next thing. We've asked the consultant to bring us examples from other cities about how they're funding that. That will be a question. That's really a revenue question that the council president's already, I think, addressed. That's a challenge. In terms of, so that's, I think, the answer to your first 2 questions. In terms of the community of people who have physical disabilities, the numbers have grown, and we really see that as the failure of every other system. When a person with a disability ends up at our front door, that means that every other system has failed, because people who are in wheelchairs, nobody should be homeless, but people who have physical disabilities and parents, I mean, should never end up in our door. About 70% of our shelter beds are accessible. They're just always, shelter capacity is accessible. It's not always available. What the Dominique Howell situation brought to our attention, I think, is the whole issue of ADA compliance and disability friendliness. And so we do have a meeting on the books with all of the disability public interest lawyers, Liberty Resources, Ms. Howell herself, to really explore whether our policies and practices should be updated and how we should do that, and if we should really do some additional training to kind of bring people along so that we can make sure that in the unfortunate event that people with disabilities, physical disabilities, need to access our system, that we can do so in a way that's as humane and dignified as possible.
Yeah. Yeah, well, thank you, Council President, for letting me squeeze in a bunch of questions. But just for clarity, this was a case that the office, OHS, and our office worked on. But Ms. Howell is disabled, you know, and has 3 kids, I think, one kid,
4-year-old.
1 child, and you know, our shelters don't provide aids. We're not able to do a lot of that stuff, and so this is something that we really have to spend some more time on.
Right, and we will never be able to provide aids.
Thank
I think
you.
the issue, the misunderstanding was that whether the state The state authorizing entity told us that they wouldn't pay for the aid if she came into shelter. And that's when the lawyers had to get involved and get everything straightened out. And it's still not 100% clear. There's a disconnect between the systems.
Yeah, thank you.
Yeah, thank you.
Thank you, Councilwoman. Chair recognizes Councilwoman Blackwell.
Thank you, Mr. President. I wanted to thank certainly Liz Hirsch and those long-term folks like Roberta and short-term folks and all that we do. We all know how important it is to get people in their first places and have them be trained how to live and have the system try to help them with being able to pay their rent, etc. I agree with my colleagues, Maria Quinones and Mark Squilla, that, and I support them and think we all will in terms of your ask for what you need for programs that affect them, as well as, and this whole opioid crisis, as well as programs that affect those who are on the streets. And you've always done a good job. It's just amazing how many of the same questions we have, kids who age out, and how many years we go through this. But let me say we appreciate all that you do, and thank you.
Thank you.
Thank you, Mr. President.
Thank you, Councilwoman. Chair recognizes Councilwoman Reynolds Brown.
Good morning. Good morning.
Good morning.
Thank you for all that you do every day to help the least among us in many ways. It's incredibly important. I had an experience this past Saturday in between multiple stops at 38th and Spruce, where going into Wawa, I was approached by a mother who was homeless with her 11, 12-year-old son. And so after doing what I could, I was lucky enough to run into Councilwoman Janie Blackwell, who was also on her way to a number of events, to ask, and so what is available for homeless parents and children on weekends? I had said to this mom, we're at 38th and Spruce, you can actually go to 39th and Lancaster Avenue, People's Emergency Center, and she shared with me that she didn't believe they had weekend hours. I don't know, but that came to my head. And then I recommended another place downtown. Councilwoman Blackwell, being the resourceful champion that she is with this issue, was able to give me the name of a location on Broad and Ridge that's open on weekends for those who are in crisis on weekends. So what I thought as I was leaving is, and so where do owners of Wawas and owners of 7-Elevens, where and who do they call when they have those kind of circumstances at their front door while people are coming in to be helpful and useful? Yeah. You know, is there a hit list of numbers where you can call OES, or you can call, my goodness, I have 4 listed before we call the police, okay? And in discussing this with my staff, we are exploring how there can be some citywide effort hit list that we give to owners of establishments so that we can inform them on who they can call to help people that are in distress. So I share that with you as a preliminary idea that's percolating in my office to see what and if we can do anything about it. Are there agencies open on weekends, just for my own knowledge base?
Yeah, yes, there are. So there's, first of all, I think your idea of the who to call list is a great idea. We would love to work with you. Actually, something that's been on our minds too, because we get so many calls. And just so you know, all this information is on our website. So that's a resource for you. The first thing is that outreach is 24/7, 365 days a year, and that's 215-232-1984. So they will always, whether it's a family or an individual, they will always come out.
Okay.
We have our intake sites actually closed. They're open 9 to 5, but we have after hours, and so Councilwoman Blackwell led you in the right direction. Red Shield Shelter, which is up on North Broad Broad,
Ridge.
just north
Okay.
of Fairmount, is the family shelter.
Okay.
And that is our intake site for after hours and weekends. And
Okay.
so either they will have a place for a family to be, so they're not on the street and they can get food and be safe and warm, protected from the elements, or they will find another place for them within our system. We have centralized intake, so everyone enters our system through one front door.
Okay.
And that's been the system for many, many years. But
Okay,
yeah,
so-
but outreach will always, you know, if you can't remember anything else, outreach will always help you.
Okay, so we need to memorize that the way we memorize 911.
Speed dial, yep. And we will work with you on the who to call, because that's an excellent point.
We'll certainly follow up with that.
And Janine just provided where to turn. Well, Project Home publishes this wonderful little thing called Where to Turn.
Okay.
And we'll distribute these. This is also on our website, but it's a great little packet, and you can print them out yourself and carry them in your purse, like
Yes.
many of us do.
Yes.
Or you can, have them in your office, whatever.
Very well. The last question is the effort that was led by President Clark and Councilwoman Blackwell. Is that a first in the country? Is it's called Hub of Hope, right? Yes. The Hub of Hope.
The Hub of Hope is the first in the country, yeah. And SEPTA really led the way on that one. They actually underwrote half of the construction, managed the construction,
right?
and Jeff Knuppel, the general manager, together with Sister Mary, raised about $1 million to furnish it. So, yeah, the SEPTA board was 100% behind it. They're the first transit authority in the country to do this kind of thing. They're a national trendsetter, absolutely.
Okay.
And we thank you all for your support of that.
Yes, that deserves an award. So someone needs to write a letter to the MacArthur Foundation.
Okay.
So the
Does
city can
deserve
be
an award.
celebrated for that.
Yes.
Thank you.
Thank you.
Thank you, Councilwoman. Chair recognizes Councilman Dom.
Thank you, Council President. I had a question for you. I just was curious. Many of the homeless people in Center City, I've actually talking to quite a few of them because I carry food coupons.
We're going to hire you for outreach now.
I'm happy to be available. I carry food coupons in my pocket and I give it to them to get food at different fast casual restaurants. But I start a conversation with them. And I'd say that of the 20 or so people in the last month, I've noticed half are from South Jersey, okay? And I said to them, why are you here? Why are you not in South Jersey? And they say to me, well, you have much better services here than they do in South Jersey. And so my question is, have you found that to be the case? And if it is, it seems unfair that Philadelphians have to pay for the services of residents of other communities, and we're taking care of it from a tax standpoint.
Well, when you become an outreach worker, we're going to have to help you sift between truth and faux fact.
Okay, I may need that training then.
Yeah. Our numbers are consistently that between 7 and 10% of the people we serve are from out of county. And they're mostly from other places in Pennsylvania. And generally speaking, they don't come here for services. They come here because they think there might be a job or family, which is, some kind of connection. So.
And here's the other question, because we get a lot of phone calls from residents who say to us, there's a person lying on the sidewalk in front of my building, and they're there every day. And I give them the homeless number to call, outreach number. And I think they generally, do a good job. But I think there's only so much they can do. And some people I see every day laying across the sidewalk. Is there anything we can do about that?
Well, you're familiar with the sidewalk ordinance. Unless they're blocking an entryway or an ATM or blocking passage through, what we can do is offer them services. And as you know, we've housed almost 500 of the chronically homeless individuals who are seriously mentally ill over the last year and a half. And that, the relationship building and the engagement through outreach continues to be what works best.
I will say that one of the top complaints in my office has to do with the number of homeless people in Center City.
Yeah.
And I mean,
mine too.
Excuse me?
Mine too.
Yeah, and they call
that in Kensington,
and they get upset at us because we're not doing anything about it. I just wonder what can we do, and is there a law that we have to change to do more? I'd like to know what that is, so we can at least improve the quality of life, help the people on the street, but it also improve the quality of life for the people that are paying taxes. Have any thoughts on that?
Well, I mean, from our perspective, we know what works. The consistent outreach together with low barrier services, high quality treatment and permanent housing. That's what people really need. And everything else is just, reshuffling the deck chairs essentially, because the people have real needs. They're alive, they're human beings, and if we don't meet their needs, the problem just moves somewhere else.
But what do you do with the large volume of people who don't want to come in, don't want the services, and are professionally begging on the street?
The panhandlers, we think about half of them are housed, and they're coming to they're making money, and it seems largely driven by the opioid situation. I think we would very much like to try there's a better way. Albuquerque is a model of day labor that has been used with some success, and we would love to try something like that. And I think there's been some outreach by the Mural Arts Program and BARA to see if we might be able to try a pilot, because they have economic reasons for being there.
Okay, thank you. Thank you very much. Thank you, Council President.
Yeah, okay, yeah, sure.
I know you know about this, Liz. We did that pilot in Center City.
Yep.
Where I made a donation to, and they approached like 662 people. I think I donated $75,000 of my own money. I was told 4 to 6 people came in for permanent, 30-something, 35 to 40 people went to Broad Street Ministry, took showers, but they had approached 663 people. And I said to myself, how do you solve this? I mean, there's an effort I tried to make to help the situation, and we couldn't help the situation. So in conjunction with what Councilman Squilla is saying, and Councilwoman Sanchez, and all of us, we need the solution. I mean, because clearly that didn't solve anything.
Mm-hmm. And that pilot, well, first of all, the data in that pilot, I think all the participants agreed that the data quality was not there, because they did not have the ability to connect the data from the people on the street with the system, with the database we have. But it is being expanded again. It's starting up, I think, at the end of this month, and there will be teams. The Center City District is funding it. And what really became valuable out of that pilot was that the homeless outreach worked very closely together with the police. And so they were able to get, I think, more people 302'd than they have been able to previously. And they were able to really, I think, get the message across that there were services available and that it was serious and that they should take advantage of that. And I think it also gave the community some comfort that more attention was being paid. So the plan is to expand that pilot this summer and to have transportation available and to have a better system of data gathering so we know what the real results are. But again, to get back to the same point, it comes down to having adequate services available so that people have their needs met in some other way.
Okay, thank you for your testimony today.
Yeah.
Thank you, Council President.
Thank you, Council President. I want to thank you for the work you're doing. Very difficult work.
Thank you.
In difficult situations with, I guess in some ways, difficult funding, because there's never really enough money.
And we have a great team.
I think you do. But I want to also say, as far as I'm concerned, as I see it, I appreciate the effort that you're doing.
Thank you.
These are quick questions, and if you don't have the complete answer, I certainly would be available later. About a year ago, my wife and I went to a concert. Had a wonderful time. As we left, we were stopped by not just one, possibly up to 4 panhandlers. Homeless people are panhandlers. My wife said to me, she goes, Al, I think if you're not from the city, this would be intimidating. We didn't find it so, but it's still difficult, you know. Do you believe, and I've been told this and it may not be true, that these panhandlers are somewhat organized, that they actually, somebody drops them off in a location and they work that location? You find that might be true?
We did a survey of 129 people who are panhandling, like physically spoke to them,
Okay.
Little over a year ago. The indications were that we could not find any evidence that there was an organization. There was one small number, maybe 20%, who it appeared might be part of some kind of organized group. It really is, you know, it's the downside of having an up economy. Yeah. The reason that people are panhandling here is because there's people on the street who are, you know, have money, and people give other people money and food, and so it pays off for them. I will tell you that this is a national issue. Every city is having the same issue. We know that the opioid crisis is part of it, that people do use.
A large part, or just part of it?
Most people that we surveyed, I think it was 60 or 70%, told us that they were going to use some of the money for drugs. So we figure if they told us that, it's, I mean, they were also going to use the money for food and a place to sleep. Some were raising, you know, money for their family. What's interesting about that, and what I think is promising, is that people treat their panhandling like a job. Mm-hmm. They show up to the same place at the same time every day with a goal of how much money they're going to make. But most of them have criminal backgrounds or can't pass a drug screen, so they're hard to employ.
Correct. It's difficult. Now, you had said, correct me if I'm wrong, that there is a project in Albuquerque, New Mexico?
Yes.
Do you know a little bit about that? Could you explain that a little further?
Yeah, it's called There's a Better Way. And basically what they do is they go out in the morning and offer people who are panhandling or say I want to work with on their signs the opportunity to work for the day and make a little bit of money. It's I believe it's a stipend, not a salary, because of trying to stay below the level of paying taxes. And it's nested in services and housing being available to people.
And okay, but what would they actually do? What kind of
They
job?
were actually cleaning up trash and bramble by the highways and in Albuquerque. That's what they're doing.
And they found that somewhat successful?
Yeah.
It's done by the municipality?
It is, in that case, done by the municipality. The models that we're looking at would be private nonprofits doing work within those nonprofits.
And do you think there's some willing people some willing organizations would like to manage that?
Well, the groups that have stepped forward so far and expressed interest are the Mental Health Partnership, the Mural Arts Program, Broad Street Ministry, Avenue of the Arts, have all indicated an interest in exploring it.
Helping.
Yeah.
Okay. All right. Thank you very much. Council President, thank you.
Thank you, Councilman. That appears to conclude the questions of this witness. I want to thank you very much for your testimony.
Thank you.
Thank you.